Well, hello there, Dr. Brian McKay, not just a chiropractor for Stanford, Darien, Norwalk, and New Canaan. I hope you're enjoying today's MLK Day. I think it's important to recognize the contributions that Martin Luther King made towards racial equality in this country. It's still missing the mark, and we still have a lot of work to do, but it should be something we should not lose sight of and take take the day for what it's meant to be, a remembrance of Martin Luther King and the good that he did bring to this country, and making us aware and hopefully making some inroads to change for racial equality. All right, so what's today's topic? What is the knee on track? Hmm. Well, the knee on track is a fantastic medical device, absolutely incredible, especially if you have knee pain. I mean, all too often people, so I'm 61, people in their 40s and 50s start to develop knee problems, and they don't get them fixed. They just wait till the pain gets so bad they may need surgery. And I'm seeing more people 50 and 60 going for knee replacements than ever before. And I mean, that's good because it will have better a new knee. But my concern is that they only get about 20 years is the typical lifespan of a knee replacement. So there are some side effects with that. But in one sense, you get that much knee pain, you can't exercise, so what? You gain weight, um, unable to exercise, you get cranky. There's nothing good from having knee pain. But what the knee on track is, it was developed by this company called ErgoFlex down in Conroe, Texas. And it's a fantastic treatment. What it does is it helps your body produce more of its own synovial fluid. So you say to yourself, what is synovial fluid? Well, synovial fluid is considered a substrate, okay? A substrate of blood plasma, ultra filtered blood plasma. And it's composed of a couple different things: hyaluron, lubricin, proteinase, collagenases, prostaglandins. So it has a lot, it's like a cocktail that's inside your knee. And what the knee on track does basically, uh, it helps the body produce more of it. So the synovial fluid is produced by synovium, which and it coats the tendons and tendon sheets and the surface of the joint. So it's a very powerful lubricant. It has got all those things like, again, hyaluron, lubricin, proteinase, collagenases, prostaglandins. You can look those up. I'm not going to go into explaining that. But by producing more synovial fluid, it helps to lubricate a knee. Okay? I mean, listen, also, too, is exercise, healthy diet, nutritional supplements all help increase and improve the quality of synovial fluid, but it decreases pain and inflammation. So when you have pain, you always have inflammation. It's just a fact. You know, you can Google if you have to, but trust me, it is a fact. So by increasing the production, I mean, a lot of times people go for these synthetics like a hyaluronic acid that's injected into the knee, which it does work. I mean, it has, I think it's got a 45% efficacy rate, so that's not that bad. If you got knee pain and you try it, you get a couple months of pain-free knees, that's pretty damn good. I mean, you really, you're doing yourself, you're doing yourself a favor. But the knee on track is a gentle traction unit, doesn't hurt. It goes up to about 30 pounds of pressure, and it's different settings on the device. But by producing your own synovial fluid, you can minimize knee pain, and also you're also going to keep the joint wet. Okay, per se, wet meaning lubricated. That lubrication is also important because then you're less likely to have meniscal. The meniscus is the disc in the knee. You'll have less wear and tear on that. You'll be able to exercise, which again, that also improves the levels of synovial fluid in your body. So there's just too many reasons why the knee on track is wonderful. Especially, listen, you got to exercise. We know that, and you can do knee exercises, different exercises at the muscles around the knee. But it's a cornerstone to the treatments that we do here at Core Health in Darien. I mean, so if you have sprain strain, that's a great reason why you should be on the knee on track. Is the meniscus torn? Even complex meniscal tears will benefit from having increased synovial fluid. Maybe you have a tear in the lateral collateral ligament. That's the one from the sides. And you have the medial collateral ligaments. Again, that's the ones on the inside. So you have the a ligament attaches a bone to a bone. You have one on the inside, that's the medial. One on the outside, that's the lateral. Now, sometimes from the long periods of stress, you can also have damage in the anterior cruciate ligament and the posterior cruciate ligament. Now, what you hear about these injuries in ACL or PCL, anterior cruciate ligament, and a posterior cruciate ligament. You hear these terms like a lot of times football players, soccer players, or even golfers to some extent have issues with that. And the tear weakens that connection because you have to think of the ACL and the PCL as anchoring your tibia to the femur. Fibula is not really involved. The fibula is the bone on the outside of your lower leg. So when you have tears in that, the more lubricated it is, the more likely it is to repair on its own and heal. Okay, because a tear, can heal when it has the proper lubrication and exercise to strengthen the area. So that's good to know. If you have post-surgical, if you have replaced the knee and the knee is still not near where it used to be, the knee on track can benefit that. So it's not a panacea for all knee problems, but it's a fantastic way to get that edge and being able to exercise. So, like this time of year, people start to exercise, and a lot of times they get side wind, you know, because the pain's too much. The old saying, a body at rest, that's physics, I'm sorry. Body at rest tends to stay at rest, the body in motion tends to stay in motion. Well, if you're staying in motion, you're going to have a better shot at healing and keeping that knee healthy. So when you have, say you have a knee replacement, it's not 100%. Yes, there is possibility the knee on track can help that too. Yeah, some people complain about Baker's cyst, and I have a whole different rationale on the Baker's cyst. A lot of times that forms what we call the popliteus, which is a muscle behind the knee. And when you have that, you can really work to rehab the popliteus muscle. There's several other muscles, and we're not going to go into all the muscles, but the popliteus is a major driver of pain. And when you have that nodule in the back, a lot of times it's almost like a pressure point that forms, and they call it a Baker's cyst. I mean, you feel it; it feels squishy. That's really the muscle, and adhesions that form in the muscle back there. The popliteus is the muscle behind your knee, and it kind of wraps around. And it's one of the attachment sites from the back of your knee to your upper leg as well. So you get the synovial production. You have cartilage regeneration. The meniscus is made of cartilage, so this helps regenerate the cartilage as well. So you really, I just went over a ton. A ton of different reasons why the knee on track is beneficial. And we typically see it takes, when someone comes in with knee pain, it takes about 2 months to really heal it. But it's a lot of fun when you see people come in with pain in their knee and they can't exercise. Now they can't exercise because you fixed it. The program we have here at Core Health is very, very different, and there's a lot more to it than just getting on the knee on track. It's good, but it's not the whole end all. You have to address, like I said before, the muscles. You got the popliteus, you got the pes anserine, sartorius, gracilis, rectus femoris, biceps femoris. You have many different muscles. You have the obturators muscles, the adductors, the abductors, even all the way up to your trunk flexors, the iliopsoas and the iliacus. So these are all areas that would benefit from a treatment, and that's how we really kick butt when it comes to knee pain, is basically that we really work on the whole knee. And so it's I guess I like that term, kick butt, but it really has a profound implication when someone is now able to exercise without knee pain. Knee pain makes you feel old. No one likes it. No one wants it. And you can take Advil and leave all you want. Advil and leave will cover the pain up. I mentioned before is the prostaglandins. Well, that's one of the mechanisms of Advil and leave. But if you have enough synovial fluid, you'll have the benefit of the prostaglandins as well. So, the knee on track. Ergoflex Technologies in Conroe, Texas, makes these units, these medical devices. And I have to tell you, I think I'm the only person in Connecticut who actually has one. Um, and it's a tremendous way to treat a knee. I mean, it gives you so much more options than just doing knee surgery. Because knee surgery, you're going to go and you take something out, unless you're getting a knee replacement or even a partial knee replacement these days. So if you want to try it, if you have any questions, feel free to give me a call. Our office number is 203-656-3636. 203-656-3636. I'm Dr. Brian McKay, Core Health in Darien. My podcast, Not Just a Chiropractor, Stanford, Darien, Norwalk, New Canaan. All right, you take care. Have a great MLK day, and I'll talk to you soon. Thank you.